mantra tones, hand gestures called mudras, and meditations. The author covers samples from each of these practices with research to support them, case studies, and scripts. Yoga in all its forms, when practiced with attention to body sensation and breath, can offer a window through whatever mood is visiting. As a client or a student begins even a brief daily dose of yoga at home, that window widens. In the language of mental health, yoga practices can begin to expand the window of tolerance. The practice of yoga in a clinical setting, when applied in the relational field of a therapeutic alliance, not only strengthens that alliance, but gives the client agency to manage their mood state between sessions. As Schwartz makes clear throughout, the client or student is always given a choice. In the scripts included here, practices are offered to the client. Clients are encouraged to experiment and are reassured by the therapist that there's no way to do this wrong. If something feels uncomfortable for the client, that practice can be stopped, but it may also be an avenue for deeper therapeutic exploration. As Babette Rothschild makes clear in her book, 8 Keys to Safe Trauma Recovery, the client is in the driver's seat. Compliance, that is, the client's adoption of the yoga interventions that the therapist has shared, works best when they are co-created in the session with the client, rather than prescribed. This approach provides the client agency and control. I love the way Arielle Schwartz cautions the listener to move slowly when introducing even the simplest yoga-inspired practices. She fully understands that many of us have had to wall ourselves in layers of necessary protection, especially when we've experienced early childhood trauma. We have lived behind those walls for so long, we are often unaware of what lies beneath the surface of our vigilant competence and control, or our sense of inadequacy and collapse. As we relax the vigilance that has protected us and regain admittance into our feelings, we may be flooded with emotions and memories. In the safe container of the therapeutic bond, grief, shame, anger, or other emotions that have been tamped down, perhaps even constricting the diaphragm and affecting our ability to breathe deeply and easily, can be safely released without embarrassment or shame. When we integrate somatic awareness at a pace that feels nourishing and supportive, says Schwartz, we can ultimately build trust that we can handle discomfort while maintaining a sense of safety. With the co-regulating presence of an attuned psychotherapist or yoga professional, the client's capacity to turn toward their distress without becoming overwhelmed by their pain is strengthened. Schwartz recommends that the therapist first help the client access an internal felt sense of safety and ease in the here and now, before the deeper work of psychotherapy begins. Small doses of yoga-inspired practice can be introduced as turning the attention inward is tolerated. Moreover, Schwartz says, the internalization of positive and nourishing relationship experiences enhances our internal capacity to respond to ourselves with compassion and care. We were born in relationship, umbilically connected. We are hurt in relationship. We heal in relationship. The most healing element in any psychotherapeutic modality or yoga practice is the love in the room. This is the way Schwartz describes the attunement in the consultation room. We offer right brain to right brain communications through our nonverbal gestures, postural changes, facial expressions, voice tone, and empathic emotional mirroring. We offer the regulating presence of our social engagement system through the conscious use of breath and movement. In this manner, an attuned therapeutic relationship can be thought of as an interpersonal yoga practice. This applies equally to a yoga class or a yoga therapy session. In weaving yoga practices into talk therapy, it is vital to meet the client's mood so that they feel fully seen and understood. If we jump too quickly into attempts to regulate our client, the author says, we run the risk of inadvertently